Hello everyone, my name is Larry Rower and I wanted to take a few minutes of your time to discuss cybersecurity in healthcare. The vision of this proposal is to prevent your hospital or organization from being the victim of a cybersecurity attack or breach. The problem is that healthcare facilities have a number of vulnerabilities to attack when it comes to cybersecurity. It is easier to attack virtually rather than physically, as hospitals are more reliant on devices that need to connect to a network. Some tertiary care hospitals have determined that they have an upwards of 24,000 technological devices, leaving them very vulnerable to attacks. Patient health information, medical device integrity, and patient safety are all at risk of an attack. Cybersecurity relates to anything related to technology and not just hacking. In our organization, a patient died as a result of telemetry monitor speakers being disconnected. The patient went into a lethal rhythm and nobody heard the alarms going off. Patients have overcome security measures on IV pumps or PCAs to alter their rates of medication administration. Money, data, patient information, and the ability to provide services are all areas that are vulnerable to attacks. These attacks do not always occur from outsiders, but by current or former employees who have the access and malice to do harm to the organization. The number one documented reason of cybersecurity breach is theft or loss of computers or laptops. Patient information is left on unsecured devices, allowing anyone access to it. Protection from attacks is compromised because of outdated hardware or software, as many computer systems do not have the security measures in place that newer technology offers. Even some of the best and widely known corporations have been breached, causing millions of patients to have information stolen from what was thought to be secured systems. These 10 cases displayed here total over 100 million patients and billions of dollars in fines and costs. There are a number of recommendations or best practices that have been described by government organizations, as seen in this image here. Performing a risk assessment of your organization is one key area, so that vulnerabilities can be defined. Upgrading software and hardware so that the most up-to-date security measures are in place is another example. Attackers are aware of the vulnerabilities and use it to their advantage to attack organizations. Many times these technologies are used beyond their intended life cycles. Plus, healthcare organizations and manufacturers should collaborate about security hazards that exist when looking to implement new systems during the design phase and not after implementation. Protecting devices through increased authentication steps, more secure passwords, ensuring good computer habits are other changes that are necessary to increase protection. Also, creating a culture where reporting breaches are non-punitive is necessary to ensure that users are reporting issues so that the risks can be mitigated in a timely manner. There have been some cases where the severity of the patient health information breach was related to the delay in notifying security because they were scared to report the loss of the device, which allowed more time for data to be stolen. Determining the cost of a breach for an organization is difficult and dependent on each situation. It can be affected by the costs for fines such as HIPAA violations, legal fees, and any other mitigation payments. Some examples include the fines to large organizations such as CVS and Blue Shield, which range from $1.5 to $2.5 million for a single breach. The Target credit card breach a few years ago cost the corporation over $148 million in total. Cybersecurity attacks cost to the retail industry is only 1/3 of the healthcare's costs. In 2013, a Washington hospital had over $1 million stolen from their payroll accounts through hackers. The WellPoint data breach in 2010 affected over 600,000 patients' data that were left accessible and were fined $1.7 million by HHS just for the HIPAA violations alone. Because of incidents such as these, Health and Human Services has put mandates out to enhance security measures, and violations are being issued with more severe fines for those who refuse to upgrade their systems. Very few organizations can say that they have not been affected or been a victim of cyber attacks. Over 90% of healthcare facilities have reported that they have been a victim of a breach. A rehab facility in Pennsylvania, where 2 USB drives were lost, compromised over 1,100 patients' health information, and was information that was not encrypted or password protected. This is just a small example of what qualifies as a cyber attack. The Ponemon Institute has conducted research about the cost to organizations for a breach and believes that it's around $360 per patient per incident. The difficulty is understanding what it costs to prevent a breach to conduct an honest risk analysis. One example claims that the cost of prevention could be as little as $8 a patient. In an organization that sees 1 million patients in a year, that is a budget of $8 million. In the case of the rehab hospital, the jump drive incident would have cost about $800,000 using Ponemon's estimates. In the Methodist Hospital of Southern California, they were able to implement an integrated systems management program that looks at their risk assessment, mitigation, and continual management of technology. Their process has labeled them as one of the best practices for implementing cybersecurity programs in a hospital organization. The implementation of this process will start with testing our vulnerabilities. Updating software and hardware will be the most costly step of the process, but low-cost solutions such as teaching staff to secure their devices, encrypt patient information, and ensuring timely reporting of theft are easy wins and key to success. While advertising that these measures have been put into place is not a way of distinguishing ourselves from our competitors, there is no price tag for losing a customer because of a cybersecurity attack. There are a number of compliance requirements by HIPAA and high-tech as well as changes put into place by President Obama with his executive order related to cybersecurity in 2016 for governmental agencies. Putting these into practice too will also be key for success. This team needs to consist of a Chief Information Officer, followed by a Director for Cybersecurity. In order for this to be successful, cybersecurity needs to be its own department between IT and security. They will also need a number of IT analysts and experts to deal with the software issues, as well as individuals from clinical engineering to help with the hardware components. It might be necessary to hire more individuals into these roles depending on our current staffing model for each of these areas. Education is necessary, as displayed by Methodist Hospital in Southern California, as they provide their biomedical engineers and IT analysts 3 days of training in cybersecurity upon hire into the organization. While cybersecurity is not a service that is marketable like a new procedure or opening of a new building, it can distinguish us from the competition. Cybersecurity breaches are unwanted publicity. A Rhode Island hospital was unable to provide surgical services and had to close down a third of the hospital because of a malware infection in 2010. This also shut down their ability to take trauma patients and impact their abilities in the emergency department. In the same year, the VA system was unable to provide services in their cath lab and radiology department for similar malware infections. We do not want to drive patients away from our organization and into the arms of our competitors because we did not take the time and effort to improve our computer systems and let our patients become victims. The use of the funds will be used to upgrade current hardware and software. In many cases, vulnerabilities exist using older equipment or software as they do not have the necessary protection from cyber attacks. Many MRI computers are still running on Windows 95 and leave them open to malware and other attacks. Ensuring that these components are upgraded during the expected life cycle will also need to occur to provide ongoing protection. Other money will be needed to provide education and tools to staff so that they can use effective computer security measures and practices to protect their devices and information. The partnership that needs to occur is between the vendors for the hardware and software that exist in the organization, ensuring that cybersecurity is addressed with each product and that the best protection is embedded in these devices is key to the organization's success in keeping them less vulnerable. Also, partnering with federal agencies is important. CMS reimbursement is dependent on meaningful use of technology and electronic health records. The HITECH Act, or Health Information Technology for Economic and Healthcare Act, has increased security requirements for organizations. Failure to comply with these requirements can result in financial penalties. Lastly, we need to partnership with the staff, as they are key to protecting our patient information and medical devices. Ensuring devices are secured, reporting of theft, and reporting of potential or actual threats are just as important as improved technology. The fact that healthcare industry has become so dependent on technology makes these facilities vulnerable to attacks. Patients want to ensure that they receive the best care possible, and that can be impacted by the security of the technology used in an organization. Cybersecurity attacks on healthcare organizations will be more readily known because of the reporting requirements with HITECH. This knowledge can have a negative impact on patient volumes, as they can choose to go to a competitor for the same services they can receive here. The money needed to provide better security can help in the long run by decreasing financial risk if a breach were to occur. It is better to act now and improve our current situation instead of waiting until a major breach occurs within the organization and realizing that we have vulnerabilities. Thank you for your time, and please let me know if you have any questions.